I'm founder and CEO of Mother of Fact. I'm a mom of four, one of whom is behind me right now wearing her Startup Health onesie. And as a registered dietitian and board certified lactation consultant, I wanted to make sure and grow nutrition as a standard part of women's health, specifically maternal health. And I think when I joined Startup Health back in 2021, I want to say, don't quote me on that. I had just launched, it was then called Nurture Talk, as a service to support families in infant feeding and late pregnancy, recognizing that increasing support in breastfeeding and nutrition in late pregnancy had extreme effects on not only cost savings for health systems and payers, but making sure that those outcomes of pregnancy and the first 1,000 days were improved through one of the easiest to move needles, nutrition. And through that, really learned that our outcomes were great. Moms were engaging with our service. It was me texting with moms like 24/7 for the first year and a half to show this as an engageable and a scalable service before I even went in and raised any money or gained partners. Mother of Fact right now is delivering a digital first service that brings dietitian care into the homes of families and healthcare systems that's reimbursable, culturally tailored, but built right into OB flows or obstetrician or midwife or those women's health clinic workflows to say that nutrition can be highlighted. We can do it at scale without you having to lift a finger, and your parents and patients are empowered through that process because of our app that we have that the users use. And the only way that users can get on now is through a referral through a healthcare system or an organization that are serving these patient populations intentionally because of what you asked. How are we coming into those first 1,000 days? And it's coming in as early as possibly, as seamlessly into the clinical experience of planning to have a baby, of going through prenatal and postpartum care, so that we can be there every step of the way because we know nutrition can be low lift and it can move the needle, but everybody eats. And eating healthy or finding the right foods in a budget is really hard sometimes. And we come in and not only do that one time, we're not one dietitian referral, we're not one dietitian visit. We are living on these families' phones through the entirety of that journey, so that when it comes down to those decisions of I'm at risk of gestational diabetes or I'm at risk of high blood pressure, I know I should be eating these foods, but my WIC check doesn't come in until next month, and I don't know what kind of beans to buy for high fiber. Our dietitians are there through that entire journey, and we're there in a way that's affordable and recognizable within that clinical journey. So that information is also getting back to those providers and empowering them in their journey because those of us that work in women's health, we know there's an OBGYN shortage. We know that maternal care deserts are only growing, and we know that patient populations that speak different languages and have different needs are only growing, on top of the fact that at minimum, 50% of these pregnant populations are showing some type of nutrition risk. 1/3 of maternal deaths are directly related to malnutrition or lack of nutrition care. And so I was on my third maternity leave and said, let's build a business, and became a tech founder like any normal person did. And over the next couple of years, I'm really built it looking clinical first. What is going to be most helpful for the clinical ecosystem, because we have to integrate. We cannot be an external marketplace for nutrition. We still have to do the legwork on paying for it and still have to do the legwork of finding a solution. Nutrition needs to be incorporated into the medical home. And so that's where that focus has been. And through working with our early healthcare systems, really developed a protocol to get into systems very quickly, make sure patients are onboarded at the right time, as early as possible in pregnancy or fertility planning, keeping them engaged and getting that data back to the healthcare system.